Viruses can spiral out of control. Imagine waking up with a scratchy throat. Nothing dramatic. Nothing frightening. You tell yourself it is probably just a cold. You drink something warm, continue your day, and try not to think about it. But by evening, your temperature begins to rise. Your muscles ache. Your breathing feels heavier. The same invisible particles that seemed harmless a few hours ago are now multiplying inside millions of cells. That is the unsettling truth about viruses. They are too small to see, yet some can move through a body, a family, a city, or even the world with astonishing speed. Most viral infections remain mild and disappear with time. But under the wrong conditions, a virus can gain the advantage. It can spread faster than the immune system can contain it, reach vulnerable organs, trigger dangerous inflammation, or pass silently from one person to another. So what exactly is a viral infection? What symptoms should never be ignored? Who is most at risk? How do doctors find the cause? What treatments actually work? And when does a simple illness become a medical emergency? This video explains the answers in clear, simple language. It is for education only. It cannot diagnose an individual illness or replace advice from a qualified medical professional. Let us begin with the most important idea. A virus is not the same as a bacterium. A bacterium is a living cell that can often grow on its own. A virus is much simpler. It is essentially genetic material wrapped in a protective shell. It cannot reproduce by itself. To make more copies, it must enter a living cell and use that cell's machinery. Think of a virus as a set of instructions that breaks into a factory. Once inside, it forces the factory to produce viral parts instead of doing its normal work. New virus particles are assembled, released, and sent to invade other cells. This process may damage or destroy infected cells. But the virus itself is only part of the story. The immune system also responds. It sends chemical signals, activates white blood cells, raises body temperature, and creates inflammation to slow the infection. That response is usually protective. Fever can make the body less comfortable for some pathogens. Mucus can trap particles. Coughing can help clear the airways. Fatigue encourages rest while the body redirects energy toward defense. However, inflammation can also cause symptoms and, in severe disease, may contribute to tissue damage. This is one reason two people infected with the same virus may have very different experiences. One person may barely notice the infection. Another may develop pneumonia, dehydration, inflammation of the brain, liver damage, heart complications, or worsening of an existing medical condition. The outcome depends on the virus, the amount of exposure, the place where it enters the body, the person's age, immune response, vaccination history, general health, and how quickly appropriate care begins. The phrase out of control can mean several different things. First, the virus may reproduce rapidly inside the body. Second, it may spread from the original site to another organ. Third, the immune reaction may become excessive or poorly regulated. Fourth, the infection may persist for months or years instead of being completely cleared. And fifth, at the community level, transmission may accelerate before public health systems recognize what is happening. Not every virus behaves this way. Some mainly affect the nose and throat. Some attack the lungs. Some target the digestive system. Others can affect the liver, skin, nerves, blood, immune cells, or reproductive organs. A few can remain inactive inside the body and reactivate later. This diversity is why the words viral infection do not describe one single disease. They describe a large family of illnesses with different routes of transmission, different symptoms, and different treatments. Respiratory viruses usually spread through particles released when an infected person breathes, speaks, coughs, or sneezes. Gastrointestinal viruses may spread through contaminated hands, food, water, or surfaces. Some viruses spread through blood or sexual contact. Others are carried by mosquitoes, ticks, or other animals. Some can pass from a pregnant person to a baby, and some spread before the infected person realizes that anything is wrong. That last point matters. A person does not always need to look severely ill to transmit a virus. Symptoms can be absent, mild, delayed, or mistaken for something ordinary. This gives some viruses time to move quietly through households, schools, workplaces, hospitals, and crowded public spaces. Now let us look at the main symptoms. Because viruses can affect many organs, there is no single universal symptom list. Respiratory infections often cause a runny or blocked nose, sore throat, cough, sneezing, fever, chills, headache, muscle aches, tiredness, or reduced appetite. Some people develop wheezing, chest tightness, shortness of breath, or pain when breathing. Digestive infections can cause nausea, vomiting, watery diarrhea, stomach cramps, fever, headache, or body aches. The main danger in these illnesses is often dehydration, especially when vomiting and diarrhea are frequent. Signs of dehydration may include a dry mouth, intense thirst, dizziness when standing, unusually dark urine, much less urination, weakness, confusion, or unusual sleepiness. Viruses that affect the liver may cause tiredness, nausea, abdominal discomfort, dark urine, pale stools, yellowing of the skin or eyes, and loss of appetite. Some viral infections cause a rash, swollen lymph nodes, mouth sores, red eyes, or painful blisters. Others may affect the nervous system and cause severe headache, neck stiffness, confusion, unusual behavior, weakness, loss of balance, or seizures. A chronic viral infection may produce few symptoms at first. A person can feel normal while slow damage develops over years. This is why screening and testing can be important for infections such as viral hepatitis or human immunodeficiency virus, especially when a person has known risk factors. Symptoms also change with age. A young child may not be able to describe chest pain, dizziness, or difficulty breathing. Instead, warning signs may appear as poor feeding, fewer wet diapers, unusual crying, extreme sleepiness, reduced activity, grunting, fast breathing, or the skin pulling inward between the rib. Older adults may not always develop a high fever. Their first sign of serious infection may be sudden weakness, confusion, a fall, reduced appetite, or worsening of a chronic condition. The pattern of symptoms is often more useful than one symptom alone. For example, mild nasal congestion that gradually improves is different from an illness that begins to improve and then suddenly returns with higher fever, deeper cough, chest pain, or severe weakness. A second decline can suggest a complication, including a secondary bacterial infection. That does not mean every returning cough is dangerous. It means that a clear change for the worse deserves attention. Now consider the factors that increase risk. At the top of the list are very young infants and older adults. Their immune defenses may be less able to contain infection, and they can lose fluids or oxygen more quickly. Pregnancy can also change the immune, respiratory, and cardiovascular systems, making some infections more serious. People with weakened immune systems face additional risk. This includes some people receiving chemotherapy, transplant medicines, high-dose immune-suppressing drugs, or treatment for autoimmune disease. It also includes people with certain cancers or advanced immune disorders. Chronic conditions matter as well. Lung disease, asthma, heart disease, diabetes, kidney disease, liver disease, severe obesity, and neurological disorders can reduce the body's reserve when infection places extra stress on it. A virus that causes 3 days of fatigue in a healthy adult may trigger respiratory failure, heart strain, dangerous changes in blood sugar, or loss of kidney function in someone already medically fragile. Vaccination status may also affect risk when an effective vaccine exists. Vaccines do not create an invisible shield that prevents every infection. Their major value is often reducing the chance of severe disease, hospitalization, complications, or death. Exposure conditions matter too. Crowded indoor spaces, poor ventilation, close contact with an infected person, shared living facilities, inadequate sanitation, unsafe food or water. Travel to areas with active transmission, mosquito exposure, contact with animals, and unprotected exposure to blood or body fluids can all increase risk depending on the virus. Another risk factor is delay. Some antiviral medicines work best when started early. Waiting until symptoms become severe can close a valuable treatment window. This is especially important for people at high risk of complications. The next question is diagnosis. How does a doctor know which virus is responsible? The process usually begins with the story. When did the symptoms start? Did they begin suddenly or gradually? Was there travel, an insect bite, a sick contact, contaminated food, a new sexual exposure, an animal exposure, or a recent medical procedure? Is the person vaccinated? What medicines do they take? Do they have chronic conditions? Is anyone else in the home or workplace ill? The clinician then examines the patient. They may check temperature, heart rate, breathing rate, blood pressure, hydration, mental alertness, the throat, ears, skin, lymph nodes, chest, abdomen, and nervous system. A small device called a pulse oximeter may estimate oxygen saturation. But one normal reading does not explain every symptom, and home devices can sometimes give inaccurate results. The number must be interpreted together with breathing effort, skin color, circulation symptoms, and the clinical examination. Testing depends on the suspected infection and whether the result would change treatment or infection control decisions. For respiratory illness, a sample may be taken from the nose or throat. Molecular tests, often called PER or nucleic acid amplification tests, look for genetic material from a virus. Antigen tests look for parts of the virus and can give faster results, but some are less sensitive. This means a negative rapid test does not always rule out infection, especially when symptoms and exposure strongly suggest it. Doctors may use blood tests to look for inflammation, organ function, antibodies, viral genetic material, or signs of dehydration. A chest X-ray or other imaging may be needed when pneumonia or another complication is suspected. In severe neurological illness, specialists may test fluid from around the brain and spinal cord. For hepatitis and other chronic infections, diagnosis may require more than one test to show whether the person was exposed, whether the virus is still present, and whether organ damage has occurred. The goal is not simply to attach a name to the illness. The goal is to answer practical questions. Is this person stable? Are the lungs, brain, heart, liver, or kidneys involved? Is there a specific treatment? Could the infection spread to others? Does the patient need monitoring at home, urgent assessment, or hospital care? Now we come to treatment. The first principle is simple. There is no single medicine that kills every virus. Some viral infections have highly effective antiviral treatment. Others have medicines that shorten illness or reduce the risk of complications when started early. For many common infections, treatment is mainly supportive while the immune system clears the virus. Supportive care can include rest, adequate fluids, nutrition as tolerated, control of fever or pain, and monitoring for worsening symptoms. The exact plan depends on age, pregnancy, medical history, the type of infection, and the medicines already being used. Over-the-counter drugs are not harmless simply because they are easy to buy. Some are unsafe for young children. Some can interact with prescription medicines. Some can worsen kidney, liver, stomach, blood pressure, or bleeding problems. And taking two cold remedies together may accidentally double the same ingredient. The safest approach is to follow the label, use age-appropriate products, and ask a pharmacist or clinician when there is uncertainty. Never give aspirin to a child or teenager with a suspected viral illness unless a qualified clinician specifically instructs it because of the risk of a rare but serious complication known as Rye syndrome. Hydration is especially important with fever, vomiting, or diarrhea. Small, frequent sips may be easier to tolerate than a large drink. Oral rehydration solutions can replace water and essential salts more effectively than very sugary drinks in significant diarrhea. But a person who cannot keep fluids down, is becoming confused, or is urinating very little may need intravenous fluids and medical supervision. Antiviral medicine must match the virus. A drug used for influenza will not automatically treat herpes, hepatitis, HIV, or another viral disease. The dose and duration may depend on kidney function, age, pregnancy, disease severity, and drug interactions. This is why using leftover medication or medicine prescribed to someone else is unsafe. Antibiotics are different. They treat certain bacterial infections. They do not treat viruses such as the common cold or influenza. Taking antibiotics just in case does not make a viral illness disappear faster. It can cause side effects, allergic reactions, disruption of healthy bacteria, and antibiotic resistance. However, a person with a viral infection can sometimes develop a bacterial complication. Examples include some cases of bacterial pneumonia, ear infection, or sinus infection. In that situation, a clinician may prescribe antibiotics for the bacterial problem, not for the virus itself. Severe viral illness may require hospital care. Treatment can include oxygen, intravenous fluids, careful monitoring, specific antiviral drugs, medicines to control seizures or inflammation when appropriate, and support for failing organs. Some patients need mechanical ventilation to help them breathe. Others may require kidney support, intensive monitoring, or treatment for blood clotting problems. Early supportive care can be life-saving even when no virus-specific drug exists. Modern treatment is not only about medication. It is also about timing, monitoring, and preventing complications. A patient who is safe at home today may need reassessment tomorrow if breathing, hydration, alertness, or pain changes. Now let us talk about prevention, because the best time to stop a virus is before it gains momentum. Vaccination is one of the most effective tools available for viruses that have recommended vaccines. Good ventilation and cleaner indoor air can reduce the concentration of respiratory particles. Staying away from others while acutely ill can reduce transmission. A well-fitting mask can add protection in crowded indoor spaces during outbreaks or around people at high risk. Hand washing is especially important before preparing food, after using the bathroom, after caring for a sick person, and after contact with vomit, diarrhea, or contaminated surfaces. Food and water safety matter for viruses that spread through the digestive system. Mosquito and tick protection matter in areas where vector-borne viruses circulate. Safer sex, sterile medical equipment, screened blood, and never sharing injection equipment reduce the spread of blood-borne viruses. Prevention must match the route of transmission. A single habit cannot block every virus. And now, the most important section of this video. When is urgent medical help needed? Seek emergency care immediately when a person has severe difficulty breathing, gasping, choking, or cannot speak normally because of breathlessness. Urgent help is also needed for persistent chest pain or pressure, blue, gray, or unusually pale lips or face, sudden confusion, inability to wake, fainting, a seizure, or new severe weakness. Call for emergency help when there are signs of severe dehydration, such as almost no urination, extreme dizziness, collapse, confusion, or inability to drink. A severe headache with fever, neck stiffness, confusion, sensitivity to light, a seizure, or a rapidly worsening rash requires urgent assessment. So does coughing up significant blood, uncontrolled bleeding, severe abdominal pain, or yellowing of the skin accompanied by confusion or repeated vomiting. In babies and young children, emergency warning signs include struggling to breathe, grunting, pauses in breathing. Ribs pulling inward, blue or gray skin, inability to feed, very few wet diapers, extreme sleepiness, limpness, or a seizure. A fever in a very young infant should be assessed promptly according to local medical guidance, even when the baby does not look severely ill. Pregnant people, older adults, immunocompromised patients, and people with serious chronic disease should contact a healthcare professional early when viral symptoms begin, because treatment or closer monitoring may be needed before the illness looks dramatic. Also seek medical advice when symptoms are steadily worsening, when fever persists, when pain becomes severe, when a person cannot keep fluids down, or when symptoms improve and then return with greater intensity. Trust changes you can observe. A number on a thermometer is useful, but the person's breathing, alertness, hydration, skin color, pain, and overall direction of illness may be even more important. Do not drive yourself to emergency care if you are fainting, severely confused, having a seizure, or struggling to breathe. Call local emergency services. If the illness may be contagious, tell the dispatcher or medical facility about the symptoms before arrival when possible, so staff can prepare appropriate precautions. There is one final danger worth discussing. Fear can also get out of control. Dramatic claims spread quickly during outbreaks. A post may say that doctors are hiding a cure. A video may promote a chemical supplement, veterinary drug, or extreme dose as a guaranteed treatment. Another may claim that every fever is harmless or that all vaccines and medicines are dangerous. These messages can delay real care. Reliable medical guidance rarely promises certainty. It explains benefits, limits risks, and what to do when the situation changes. When information is confusing, check whether it comes from recognized public health authorities, licensed medical professionals, peer-reviewed research, or official treatment guidance. Be cautious when someone sells the solution they are urging you to fearfully buy. Viruses are powerful because they exploit living cells and opportunities for transmission. But they are not magic. They can be studied, detected, prevented, and treated. The human immune system clears an enormous number of viral infections every day. Vaccines train immune memory. Diagnostic tests help identify the cause. Antiviral drugs can stop specific viruses at critical stages. Supportive care protects the body while recovery takes place. Public health measures break chains of transmission.